Hi, my name's Nicola and I'm the course manager as well as one of the mentors here at Mediterm Training. The purpose of this YouTube video is to act as a revision session to revisit some of the commonly confused terms that come up on the course. It also provides an opportunity for us to go through a past paper, looking at various sections and questions on the paper to ensure you're fully prepared for the exam. The paper we're going to look at is the November 2013 paper. This will have been sent to you as an attachment in the email that contained information about this video link. So make sure you have this in front of you and we'll revisit it later. Before we go any further, I want to reassure you that a lot of people start to get exam anxiety at this stage in the course. We receive a lot of emails from people saying they're not prepared, there's too much to learn, they're worried they're not going to pass, can they postpone the exam till next time? And although a lot of people feel like this, the reality is that most people, in fact a very high percentage of people that study with us, do in fact pass. And the key to you passing is to doing as many past papers as you can. At level 2, there's only so many items in the syllabus, so the more papers that you do, the more chance you have of seeing something that you did on a past paper coming up for real in the exam. Now there are 4 past papers on the course. These are all marked by your mentor and can be found on the link to Module 6. Do them one at a time, allowing time for your mentor to give you feedback between each paper. There are then another 6 past papers on Module 6, which you can complete yourself and ask your mentor to send you the answers so you can self-mark it. And if you're really keen, your mentor will also be able to send you some attachments with further papers on. Now the paper itself is worth 80 marks. As with the past papers and the revision tests you've been completing through the course, a score of 70% or higher is needed to pass. In real terms, this means you can actually get 24 marks deducted and still come out with a pass. In fact, you can get 7 questions wrong and still come out with a distinction. So actually they're not bad stats at all, and hopefully will fill you with a bit of confidence going into the exam. It's worth saying at this stage that AmSPA generally put a few nasty words into each exam. They do this to separate the wheat from the chaff and to really test the more able students. This has happened for years and years and years, and although we've questioned it with AmSPA, they still continue to do it. The word that might come up might be something you've not seen before, that hasn't appeared on the syllabus, and I want you to remember that students up and down the country are in the same position as you. Everyone is taught the same syllabus, the same words, and will be in the same position. So if you do recognise any part of the word that comes up, even if the whole word itself is unknown, take a guess, put down half an answer, and you never know, you might just pick up half a mark. But whatever you do, don't let these nasties throw you. We know they're going to come up and we just need you to be prepared for them.
Okay, so the first word parts we're going to look at are lapero and gastro. We've chosen these because AmSPA generally tend to put them on a paper because they're words that most people do get confused with, and as a result they may well come up on your exam. So let's try and be one step ahead of the game and get our heads around it. So I want you to think which of these 2 words means stomach. Is it lapero or is it gastro? Now if you said lapero, you'd actually be wrong. Lapero refers to your abdomen, and your abdomen is a space within the body. It's a cavity that holds your internal organs, and as such it's not an actual body part, it's not a thing. Whereas gastro does refer to your stomach, and as a result of that we could have, if we remove this O here, because the suffix starts with a vowel, we can have a gastrectomy, removal of the stomach. Following that same principle of removing the O, because your suffix starts with a vowel, you can't have a laparectomy, because lapero isn't a body part, it's not something you can have removed. If you were to put that on your paper, you would be wrong. Removal of the stomach, gastrectomy. So the next 3 word parts we're going to look at are these 3. Otomy, ostomy, and oscopy. 3 words that all sound really similar but in fact have very different meanings, and as a lot of students confuse these words as well, they're likely to appear on the paper in some form or another. So let's try and make some sense of them. Starting with otomy. which is a cut or an incision. So let's take the example of a tracheotomy. So a tracheotomy is a cut across the trachea in the neck, the windpipe, when somebody is choking in an emergency situation to allow that person to breathe. The next one, tracheostomy, is an artificial opening. So that's when you see people, if they had a tracheostomy, it's a more permanent measure. They have a tube in their neck to assist them with breathing longer term. And a tracheoscopy is a procedure of examining with a lighted instrument. So again, in this example, a tracheoscopy would be a camera going down the trachea to investigate. Now, a good way of remembering these, if you see here, there's a T, and here there's an ST. Think with otomy that the T stands for temporary. So a cut or an incision during the surgery is just going to be a temporary measure. For a tracheotomy, it's going to allow the person to breathe momentarily, and then it will be sewed back up. With an ostomy, think of the ST standing for stays there. So the artificial opening, which is a more permanent measure. Otomy, cut, ostomy, artificial opening. Okay, the next 5 words we're going to look at are these: myo, myelo, pyo, pyelo, and pyro. All very similar sounding, and again, all words that students get confused. So if you're one of these students that finds it difficult to remember these words, listen carefully. So we'll start with myo, meaning muscle. So let's put that in context with a medical word. Now, if you notice here, we need to get rid of the O from myo because our suffix oma starts with a vowel. So the word myoma means tumour of the muscle. Now let's go down to myelo. Myelo means spinal cord or bone marrow. So again, if we use that with oma, we lose the O because our suffix again starts with a vowel, and we have the term myeloma, a tumour of the spinal cord. Moving down to pyo. Pi means pus. So a word you could use here would be pyuria. Notice I didn't put the O in because our suffix urea starts with a vowel. Pyuria, pus in the urine. This one here, pyelo. Pyelo means pelvis of the kidney. This is an area inside the kidney. So you could have pyelitis. Again, I've dropped the O because our suffix itis, meaning inflammation, starts with a vowel. So pyelitis is inflammation of the pelvis of the kidney. Lastly, down here, we've got pyro. Pyro means heat or fever. So a medical word you could have here would be pyrogenic. Genic meaning producing or forming, and pyro meaning heat. So producing or forming heat, pyrogenic. Okay, so the next suffixes we're going to look at are those really small ones that mean concerning, pertaining to, or relating to. Now there's 6 of these in total, and because they're so small they often go unnoticed by students, and therefore you may lose marks if you don't notice these on your paper. As a result, AMSPA like to put them on, and they actually featured a lot on the last paper that the students completed. Now I want you to turn over your November 13 paper, and on the other side write down as many of these as you can remember. To give you a clue, there's 6, and I'll help you with the first one, which is AC. So to put that in context, cardiac, relating to the heart. If you notice here, again, we've dropped the O because our suffix "ac" starts with a vowel, so we don't need that O and the word becomes cardiac. Now pause the video and see if you can think of the other 5. So did you get them? Let's start with al. For example, vaginal, relating to the vagina. R, ocular, relating to the eye. Ari, so an example here would be pulmonary, pulmonary meaning lung, relating to the lung. An, the word here would be ovarian, relating to the ovary. And then the last one, ick, gastric, relating to the stomach.
So now we've gone over those common areas, it's now time to look at the exam paper. And like I said earlier, the exam paper we're going to be looking and working through is the November 2013 paper. So if you don't have that in front of you, now is the time to get it. I have to apologise, the paper is in front of me here, so I'm going to be looking down a lot throughout the course of the next few minutes. So it's really important before we go on to mention about the candidate enrolment number and the centre number. These are both on the front of the paper, and although you don't know these numbers yet, your invigilator will give you a sheet of paper called the student timetable on the day of the exam. And you'll find both these numbers on the paper which need writing on the exam paper. You also need to make sure you write in block capitals and use black ink. To put it simply, if AmSpa can't read your answers, they won't give you a mark. So if you open your paper and go to question 1, you'll see you have to define the meaning of the following word parts. Write your answer in the spaces provided. Again, print clearly in block capitals. So I want you to have a go at this question. Don't look at your notes, don't Google anything, set it up like it's a proper exam to give you an accurate reflection of how you may perform on the day. Write down the answers and we'll go through them together in a moment. So if you press pause down here and then come back when you're ready. So how do you think you got on? Let's go through it together. I'll say the answers. You give yourself a mark and we'll get a total at the end, which will enable you to get a full total at the end of the paper to see how you may perform on the day. So starting with number 1, retro, the answer is backwards. 2, bio is life. 3, quadri is 4. 4, uni is 1. Number 5, litho, the answer is stone. 6, pulmono, the answer is lung. Number 7, esophago. Here you need to make sure that you put gullet. If you've put esophagus, AmSpa will deduct at least half a mark because saying esophagus is too close to esophago, which was the question you were asked. AmSpa need to see that you fully understand the word parts you're using, and using esophagus doesn't demonstrate that to them. So you must put gullet here. Number 8 is cartilage. Now make sure you've got the right spelling for this because this is often frequently misspelled as well. So C-A-R-T-I-L-A-G-E. Number 9, iatro, means doctor or physician. Appendico. Now this is a bit like esophagus in that if you just put appendix, you won't get full marks. AmSpa will deduct at least half a mark. You need to explain what the appendix is. So something along the lines of a blind-ended tube attached to the large intestine. For 11, the answer is skin. 12, graphy. The answer is the process of recording. Now, don't confuse this with gram, which is the picture itself. 13 is staxis. The answer is dripping blood. And 14, for opia, the answer is sight or vision. So I hope question 1 wasn't too difficult. Give yourself a mark out of 14, adding up all your correct answers. It's important to say here that you need to be aware when they're asking you for a root, a prefix or a suffix. A few tips on how to identify these are, if it's a root, the word part will almost always end in an O. In the examples in question 1, we've got pulmono, esophago, chondro. If it's a prefix, there will be a dash after the word part. So questions 1 to 5 in the example above, retro dash bio dash. And if it's a suffix, there will be a dash before the word part. Again, in the examples below, graphy, staxis and opia all have a dash before the suffix. This is important because there are certain words that can be used as a prefix or a suffix depending on their context. So a good example of this would be the small word an. So we saw earlier that an as a suffix means relating to. So you would see this as dash an. As a prefix, an with a dash after it, it means without, like anemia, for example. Let's have a look now at question 2. You'll see that there are 14 questions here, but that it's actually worth 28 marks, so 2 marks per question. 28 marks makes up just about a third of the paper, so it's really important not to lose any marks here and to be as accurate as you can with your answers. Any marks dropped here really are a full mark rather than half a mark, so you have to really watch out. Basically, you need to think how you can get 2 bits of information into your answer. If you only put 1 word down as an answer, they're only going to give you 1 mark. So it says here, define the meaning of each of the following medical terms. Write your answers in the space provided. Again, print clearly in block capitals. So have a go at this section. Press pause on the video now and then come back when you're ready. So let's go through the answers. Question 1, erythrocyte, the answer is red blood cell. 2, aortic. Now, did you spot the ick at the end there? So you must say relating to the main artery in the body. Again, don't just say aorta because that doesn't show an understanding, and you must say the relating to bit as well, relating to the main artery in the body. Osteitis, inflammation of bone. Pelvic, another ick, see I told you they come up a lot, relating to the hip bone. Again, don't just say pelvis, pelvis doesn't show your understanding, and you must say the relating to for the ick bit. Number 5, phlebitis, inflammation of a vein. 6, salpingogram is an x-ray or a picture of a fallopian tube. Menstrual, did you spot the AL at the end here? So it must start in relating to the monthly blood loss from the uterus, or something to that effect to describe the female bleeding. Number 8, cranium, the skull bone. Now, with me mentioning that each question is worth 2 marks, just by putting the skull here isn't really enough information. I know it seems really obvious that it's the skull bone, but to make sure you get 2 points, just putting that word bone will guarantee that. Phalanges, you need to say fingers or toe bones, same as above, making sure you say bone. Orthopnea is difficulty breathing unless upright. Cerebral, relating to, with that al, the brain, relating to the brain. Lymphatic, again, it's got an ick at the end, so relating to. So each time you've said relating to so far, even if you don't know the word, you've picked up a point. So you just by putting that, you'll have picked up quite a few points in this section. So an answer here would be relating to the body's defence system. When I mentioned earlier that AmSpa like to put a nasty on, this was one of the nasties on this paper. Lymph is quite a hard thing to explain. So relating to the body's defence system. Pharyngitis, inflammation of the throat. Not inflammation of the pharynx. That wouldn't be enough for the markers to see that you understand what the pharynx is. Inflammation of the throat. And then finally, we've got proctitis, inflammation of the rectum. So again, add up your score for this section. write it in the space and then turn over to question 3. Question 3 is match the following items with their correct meanings. Place the number of the word listed in column A in the box against the appropriate meaning found in column B. Now this part's very important. 3 meanings are not appropriate. So there's more meanings than there are terms. So have a look. For example, number 1, pyrogenic. You have to look down in column B and find which answer matches this one and then put number 1 next to the answer you think. This is actually a really easy section and a good place to pick up marks. There's 10 marks in total in question 3A and 3B. A good tip would be to do it in pencil first, and then you can always rub out any errors because some of the meanings are very similar. Make sure you have all the numbers 1 to 5 written down. Pause the video, write them down, and then we'll come back and go through them. So looking at your paper, you should have in the following order 3, then a space, 1, 2, and a space, 5, space, 4. Like I said, there are quite a few similar meanings in there, and it's really important you can distinguish the difference between them. See how you get on with question B here. Again, pause when I say so. Go through the answers, making sure you've got all the numbers 1 to 5, and then we'll go through them. So the answers you should have are number 5, then space, 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 1, 2, 4, 3. Each of those sections is worth 5 marks, so if you made any errors, you're deducting half a mark per error. So your total is out of 10 for question 3. So let's move on to question 4 now. You'll see there are 8 questions, but again 16 marks, so 2 marks per question. The examiners are looking for you to use 2 word parts in your answer, and they will deduct a full mark if one of the word parts are incorrect. To look at the question, 4A, you have to define the medical term for the following, writing your answers in the space provided and printing clearly in block capitals. So have a go, press pause and come back when you've completed this section. So let's go through the answers. A good tip here is to think about whatever the question ends with is what your answer needs to start with. So to give you an example, question 1, a tumour composed of muscle. The question ends in asking you about muscle, so your answer should start with myo, meaning muscle. So a tumour composed in muscle, working backwards, would be a myoma. Number 2, concerning the nose. Now remember, if you see concerning, pertaining, relating to, you need to end your answer with al. So the answer here would be nasal. Number 3, inflammation of the voice box, laryngitis. Notice that the X in larynx becomes a G when it's combined with the suffix. Number 4, surgical removal of the stomach, gastrectomy. Remember when we discussed before about omitting the O because the suffix starts with a vowel, so it wouldn't be gastroectomy. AMSBA would knock off half a mark for this. In fact, they knock off a full mark because each of the questions here are out of 2 marks. So the answer is gastrectomy. Question 5, the membrane lining the heart, the endocardium. A lot of students confuse endo and peri. Remember that endo means within, inside, and things that are inside are linings. So think of lining a drawer or lining a coffin. So when you see lining, you need to use the prefix endo. Number 6, an artificial opening into the large intestine, colostomy. Notice how the N has been dropped. Instead of colonostomy, it's colostomy for ease of pronunciation. An abnormal condition of the kidney is nephrosis. And finally, inflammation of the breast, mastitis. If you're only able to guess part of the word here, you'll have got a full mark. So add up your total out of 16, write it in the space. So this is the section when you're being asked to define medical specialities, again printing in block capitals. There's 6 answers here, worth a mark each, so pause the video, have a go, and we'll come back and work through them. Number 1, bariatrics. Notice as it ends in iatrics, you should start your answer with medical speciality. So in this case, it's medical speciality concerning the reduction of stomach capacity to treat obesity. Now you don't need to give an exact word for word answer here, as that would be too much to remember, but so long as you've conveyed the meaning, you'll still get the full marks. Oncology. Notice how it ends in ology, so you have to put study of, in this case study of tumours. Biochemistry is relating to the chemical contents and processes of the body. Psychology, the study of the mind and behaviour. Virology, the study of viruses that cause disease. And haematology, the study of blood. So add up your answers, knocking off any half marks, and give yourself a total out of 6 provided, and we'll move on to question 4b. So we're at the final question. All the words here relate to drug prescribing. So if, for example, the question is BP, note that it's British Pharmacopoeia, not blood pressure, as this is not to do with a drug abbreviation, although it is a medical abbreviation. This section is just looking for drug abbreviations, so don't be tempted to move away from anything that's not to do with drugs or medication. 6 answers to be given here, with 6 marks, so a point per answer. Have a go, pause the video, and we'll go through it in a second. So question 1, TTA, to take away. Question 2, HRT, hormone replacement therapy. Question 3, SI. It's a funny one, this one, because you have to work back to front. It's an international system of measurement. Number 4, mg, milligram. Be careful you don't confuse this with microgram, which is mcg. Number 5, PC, after meals. And number 6, BD, twice a day. Now this really should be 6 easy marks, as you've learnt these during the past papers and in module 6, and there's not too many to get your head round, so hopefully you'll be 6 out of 6 in this section. So that's it, that's the past paper completed. Add up all your scores for each section to come up with a total out of 80. Now if you scored 56 or above, I'm pleased to tell you that you passed. Anything from 56 to 63 out of 80 is a pass. 64 to 71 out of 80 would be a merit. And anything above 72 is a distinction. So well done to anybody that came out with a distinction after all that. I cannot emphasise strongly enough the importance of doing all the past papers that are made available to you. There's a really strong correlation between the people that don't do all the past papers with those who fail. When we get the results and we look back at the papers that they've completed, we can often see that papers have been omitted, and therefore people have missed out on the vital opportunity that they get for their mentors to give them feedback on how they've performed. That's why this course is so great. We're not just throwing a book at you or a set of words to learn. We're guiding you through each step of the process to ensure you come out with the best mark you can possibly get in the exam. Once the results are sent back to us, after 6 to 8 weeks of completing the paper, we'll let you know how you've got on and also invite you to study at level 3 if you wish to progress with your learning. So all that's left for me to say now is good luck, don't panic, use the full amount of time that's given to you for the exam. Scribble down any answers if you're not sure about them on the back of your paper, and check, double check and triple check any answers, particularly looking for all those little ick-ack relating to words that might catch people out. Fingers crossed you'll be great. Thanks for listening.